So I wanted to talk to you about what's going on with MyThrive and where we're at in the process of developing our community health needs assessment report. Just a little level setting background on the MyThrive infrastructure. We have a steering committee and a core team. So our core team is made up of the director, who is at Health Department of Northwest Michigan. And then we have a lead for each of the assessments. We've done 3 assessments. And then our epidemiology team, our epidemiologists have put together a lot of reports using the data. Community engagement leads, I'm one of those for the North Central Shire to promote all the activities going on with MyThrive and to get people engaged in the process. So you guys are in the Northwest region, and the Northwest has a roundtable. I don't know if you're on the list for the roundtable meetings, but Kyle Muchas from Grand Traverse County Health Department leads the Northwest Roundtable group. So if you would like to join that, just email me and I can get you connected. So these are the 3 assessments that I mentioned that we did. We did a community partner assessment. We had 75 community partners participating across the 31 counties, and they looked at their systems, processes, and capacities as a network for community partners together to address health inequities. We got a lot of good information from that as what our key partners and stakeholders are doing in the region. Our community status assessment, part of that is the secondary indicators on the data platform. And then we did a community survey. Some of you may have taken that survey. We got responses from about 3,500 residents across the 31 counties, not as high as we'd hope, but it was harder to get people to take a survey than we expected. So, but we did get good information. And then we had our community context assessment, which we did a photo voice project, and we did some asset mapping. So we did have at least one photo voice submission from every county. So we had 63 submissions and 140 photos captured. And those photos were looking at things in your community that promote health and also things in the community that may be a barrier to health. So for the Northwest Shire that Kalkaska's in with 4 of our DHD 10 counties, Wexford, Missaukee, Manistee, and Kalkaska, and then further north, so Grand Traverse and Benzie, Leelanau, Charlevoix, Emmett, those counties. So these were the priority areas from last MyThrive cycle. So what was prioritized for the Northwest Shire to work on was chronic disease, housing, access to healthcare, and mental health and substance use. And if you're aware of the Behavioral Health Initiative project that went on, and Suzanne was a valuable key member of our Reduce Stigma Regarding Substance Use Disorder action team. So we accomplished, I think, a whole lot related to, substance use. And there were 10 other action teams working on other aspects like access to care services and workforce development, other issues. So this time we are selecting some sub-region themes for our prioritization event. So how we did this was the epidemiologists looked at the community survey data. And so they looked at 3 questions that the community responded to. And question 2 was top factors for a thriving. What are your top factors for a thriving community? What are your most important medical concerns in the community? And then what are your most important community concerns in general? And so they organized those options into themes, and they prioritized 9 themes for each shire.
Alexis, did you have a question for Donna?
It was more of a question about the drug abuse type thing. With the bulletin board that we did here with the survey. Was I was more wondering if that was any help or use that you guys were able to use.
Oh, for the coalition, absolutely, we'll be able to use that. You're talking about the survey that they did within the school, correct? During Red Ribbon
Yeah.
Week? Yes, that
Yes.
will definitely be of importance when we go to get more funding for the coalition and just to get information out to the community.
Yep. Yeah, and that's the thing. These surveys and this assessment are not the be all end all. For example, our substance use stigma project, we had survey responses from assessing the public stigma regarding substance use, and we had, I think, 1,300 responses across 10 counties for that survey. And we surveyed healthcare providers, we surveyed law enforcement, and we surveyed people with substance use disorders. So there's a lot of surveys out there that aren't on this data platform that still would be really useful to have. We were hoping to get them on this platform, but we haven't been able to yet. So, but maybe. So these are the themes that we prioritize for the Northwest Shire, that we are going to be making a strategic issue brief for the prioritization event. So you're going to see a brief that includes all the data we collected on economic security. That was number 1. And this was rated on like the responses on the survey that people scored. What are the most important issues? We put them on a grid. And so the ones that are above the line were, we picked the top 9. So it was economic security, housing, mental health, obesity, safety and well-being, broadband access, education, access to medical care, and environment and infrastructure. And sadly, substance use was number 10, so just didn't make the cut. But I think these categories are themes are really broad enough that, if that you guys could make a case for, access to care, um,
Right.
substance use disorder. There's a lot of barriers to access to care.
So
And
why
so that,
don't so seeing a substance use disorder is actually a mental health condition. Why is it not included in mental health?
and they separated it out. I don't know. That's the way they separated the questions on the survey. So
Yeah.
people picked one or the other, instead of both. But yeah. But as I said, I think these are broad enough that,
Hmm.
and even economic security and housing are issues, and mental health is an issue that people with substance use disorders are dealing with. So once the needs assessment, we're only going to prioritize 3 or 4 of these. So at the prioritization event, you will get a data brief that's going to show all the data we collected on these themes. And then people will be asked to prioritize, using a scoring rubric. And we will pick like the top 4 for each Shire region. So our live data walk event that we're holding for the Northwest Shire is going to be on Wednesday, December 18th from 10 to 12, and it will be virtual. And you'll probably get an invitation from Kyle Muchez. He's going to be sending out invitations, and it'll have a registration link so you can actually register for the data walk event. And we'll walk you through this data. We won't be doing the prioritization at the event. A survey will be coming out, so you'll have time to kind of review and digest the information in the data walk, and you won't have to make a decision right away. And Alexis, you have a question?
So I'm not sure if that qualifies to me or not, but due to
Yeah.
me being a school email, my email does not receive anything outside of the school organization.
Oh, okay.
Be able to get the link from me because supposedly my email goes through for students, but we'll work on that. We'll see if it works.
Yeah,
Thank you.
because we'd love to have the voices of youth.
Absolutely.
Yeah.
Yep. So we'll work on that, Alexis, and make sure that you get updated information when you need it. And I can talk to Miss Short and make sure that your email address, or they can okay certain email addresses to go through to your email.
Awesome. We'll get you in there, Susanna, make sure. We also, if you can't make that one event that day, we're going to hold some office hours where you can join in virtually, and we'll walk you through the data separately. So you can attend any of these office hours. They won't be by region. So we're having one on December 13th, one on December 16th, and one on December 20th. And those will all come out in an email with registration links. So there's more than one opportunity to view the data and receive the survey. But one thing, if you submit the survey, I guess it's going to be honor system, but you will need to have either attended the data walk event or the office hours. Because we don't want people just, oh yeah, I think this is important without seeing the data. And so the priority setting scoring rubric, we haven't finalized it yet, but these are some of the things that we will be scoring on, probably the severity. So the risk of death or illness associated with the problem, and the consequences of not addressing this problem. So that more like the urgency of how urgent is it? Is it an immediate need? Another criteria is magnitude. So looking at how many people are really impacted by this problem. And then the impact, what effect does it have on health and well-being and quality of life? And health equity is the degree to which inequities and disparities exist. And then, is it sustainable? And this is pretty key. So do we actually have the resources, capacity, partnerships, and commitment to sustain the work? Because it's no sense like pie in the sky, oh, we're going to, I don't know, get everybody affordable housing, and we really don't have we may not have the capacity to really do that. So the priority setting scoring rubric must be completed by December 20th. So problem was Christmas was in there, so it didn't really give us a lot of time after the data walk events. So it'll be, quick turnaround to actually do your prioritization and get it submitted back into us. because we figure Christmas week everybody's gone, and our deadline, we contracted with the hospitals and they put in a lot of money and they expect us to have this done by the end of December. So we're on a tight timeline. And as I said, everybody that submits the scoring rubric must have participated in the data walk event or the office hour session. And these are just some resources you can find on the MyThrive website. If you go to that website, you can see a vision video that talks about MyThrive. You can see the what's going on in this cycle. You will be able to see some county level reports. So each county will have a data report. It's pretty, I don't know, pretty overwhelming. It was overwhelming for me, and I love data, but the Alcona report is like 88 pages of data. So, but if somebody is looking for something in particular, it might be useful. There's a strategy guide with promising practices and evidence-based strategies. Once the community health needs assessment is completed, then it's going to be up to the roundtable groups in each region to develop a strategic plan or a work plan to how they want to address the priority areas. You can also subscribe to a digital newsletter here, and there's contact information for the director of MyThrive. And I think that's it yeah. So thank you guys for giving me this opportunity to share. Spread the word. Like I said, you'll be getting an invitation to the data walk and the office hours. Feel free to share it with partners. Especially we want people with. We really want to really make an effort to send it out to people with lived experience or people with experiencing disparities or inequities, to get communities in this, so it's not just decision makers at the table from the top down saying this is what we need to do.
All right. Any questions? It's a lot of good information, but like you said, it's kind of overwhelming.
Well, hopefully the data briefs for the data walk we're going to pare it down to 10 pages.
Right.
So
Nobody has any other questions?
I just agree with you, Suzanne, that substance use disorder should be grouped in with mental health. It should be slotted out of that category.
Yeah, we run into that a lot where it's still, I think even on the state level, it's separated a lot. Right? Wouldn't you say, Donna?
yeah, and last MyThrive cycle, they were grouped together.
Yeah. Yeah, because a lot of times they go hand, so. And there's still major issues within the community with substance use disorder. Although I guess the last data from the state shows that overdose is going down, and they believe that directly related to the availability of naloxone within the community. So placing all these naloxone distribution out has the overdose, which is amazing. And hopefully we can continue to provide that in the areas that don't have naloxone available. And that's one thing our coalition's working on within our county.
One thing I wish would have made it on there, although it can make it under some of the, like I said, I love it, the themes are broad enough, but we just, in the North Central Shire, we just hosted 2 workshops on social connectedness. And we had a national group, Healthy Places by Design, come and provide the workshop, and was quite eye-opening. And so we had people, they had an exercise where they had a platform called Mentimeter, and it's like a poll. And so they asked people like, okay, what are some of the barriers to social connectedness? And they made a word cloud out of all the answers that people had. And right in the middle, in both workshops, we had one in Lake County, and we had for the DHD 10 counties, and we had one in Clare County for the Central Michigan District Health Department counties. And both word clouds, stigma was like bold front and center. Like that's what most people answered was a huge barrier to social connectedness. And I think that impacts, mental health and substance use disorder. There's so much stigma.